All right, let's move now into other things. So you now take this person who turns up and says, okay, I want to negotiate a new contract. Where do you start? What are you sort of looking at? What are you working with them on? What are the things we're thinking about when we're trying to put together a package, a contract?
We always start with the same thing, and that is what is important to the doctor.
Mm-hmm.
So much of a doctor's experience is dictated to them. Med school, residency, and then when they come out for the first time of training, they finally have this opportunity to say, hey, this is how I want to do things. And so we sit down with them and we always start with what matters to you. We rank 7 different things that doctors tend to express to us are important. And the top 3 things are always ranked as the most important. It's my flexibility and stability in my schedule. So a lot of doctors get burned out working call, extra hours, additional shifts. It's having free time for my personal ambitions outside of my practice. And then lastly, being fairly compensated. Now, those 3 rank differently for every doctor we talk with, but it's always those same top 3 of 7 things. And so we always start with what matters to you. And then we lean on the 15 years that we worked in hospitals and translate that into terms that your employer can understand. And then we go to your employer and say, hey, we need you to pay Dr. Smith better, or else she's going to pursue one of these other alternatives that we brought to her that improve her practice, give her better support, and spoiler, pay her a bunch more money to do it.
So these are people already employed. It's not even looking at that new job. It's looking at that, what's happening for you, and is that okay?
Exactly, exactly.
Very interesting, right? So I get a lot of pushback when I ask questions like, so can we create more time in your schedule to be able to get these people back? How do you get acknowledged for doing that virtual care work? How are you getting acknowledged for the email message that kind of turned up inside COVID? I don't think it was unique in Canada, or maybe not the whole of Canada, but it was kind of new that this portal thing would occur because of the changes that had to be made to become virtual with our patients in COVID. So we saw a lot of innovation in the area of looking after patients, not necessarily eye to eye, face to face. But I think the US was doing this much longer because of the way that their EMRs were working, and they had patients enrolled in these portals already. But I see a lot of burden of these. If there's less access, there's increasing volume of things coming in through these virtual portals. And some places are charging, some are not. Some are compensating physicians, some are not. Like, it is so different across the landscape because I hear all of the stories. And I'm so curious when I get pushback of, no, they'd never agree to that. Like, oh.
Interesting. Do your clinicians tell you that?
Yeah, physicians and clinicians are all,
Interesting.
so whatever is set up is how it is. And
Uh,
some of them have, of course, and we bring some of those stories forward in here, come back to the employer and said, hey, where's the give and take here to have a little bit more wiggle room with some of their day-to-day routines and expectations. But a lot of them are like, this is just how it is.
yeah, you bring up a really interesting point that I think a lot of doctors and clinicians in general would really relate to. When you think about any industry, technology is probably the best example. There's always new innovation and advancements. And the only industry I worked in is healthcare, specifically hospitals. And it moves so slowly, even when you're doing the right thing for the patient. There's so many layers of bureaucracy and approvals that it's almost impossible for clinicians to have agency in their job. So much so that I've had people who I admire say, I feel disposable in my job. And so I think you hit on a point that many doctors I work with would relate to, which is it is extremely difficult to get anything done that's not the way it currently is in healthcare, specifically hospitals.
Mm-hmm. Yeah, yeah, for sure. It is a slow moving target if you're trying to make changes.
The stakes are so high. Like, why wouldn't you want to always be at the cutting edge of how many times when I worked in a hospital, I had a new idea and I would have to go to infection prevention and nursing and environmental services and get everybody bought in to do something that we all know from a common sense perspective is best for the patient. But because it's different, I could never wrap my head around that.
Yeah, yeah, exactly. We often joke that a lot of the systems were not created for us, right? They
Yes.
are not created. They might be created so that we can collect more data or more information, but they're not created for our workflow or with the end users in mind,
Yes. Yes.
particularly.
I've heard that as well about some pretty prominent EMRs that they're just accounting systems. They're not built for doctors and clinicians to navigate them easily or efficiently.
Yeah, exactly. Oh, patiently. I like that.
Yeah, yeah.
Given that we just recently migrated to a new one, I hear a lot of farmers' voices coming out at work.